Yeah, let's get started. So thank you very much for everybody for joining us. This is an event organised by the GLA as part of Mental Health Awareness Week by the GLA and Thrive. So thank you very much for bringing us all together. My name's Harry Hobson. I am from Neighbourly Lab. We're an independent research organisation. We've worked with the GLA during last year on a report about loneliness in London, which I'll share a couple of highlights from in a minute. And yeah, great. Let's get going. So we've got three brilliant panelists with us. So thank you very much to all of them for joining. We've got Elime Mikulski from Little Village. We've got Muna Yassin from Fair Money Advice and Abby Gilbert from Tower Hamlets. And I'm going to ask each of them in turn just to say hi and to introduce themselves for a minute or two, just so you kind of know who they are and what they do. And then after that, I'll do a quick introduction about some of this work that we've done, but just a 2-minute introduction about the research work we've done. And then we'll get into a good conversation about the topic, which is, of course, what loneliness looks like in the context of a cost of living crisis at London. All right, brilliant. Yeah, so yeah, Elime, do you want to start and say hi and introduce yourself and Little Village? That'd be lovely if you would.
Absolutely. Hi, everyone. My name's Ella Mikulski. I am an ambassador for Little Village. Little Village are a baby bank, so works very similarly to the concept of a food bank, but instead of food, we help with items such as clothing, wipes, nappies, and other sort of equipment or toiletries, anything that you might need for your under fives and the family. Little Village have various hubs over London, which is amazing. I have first-hand experience of coming to Little Village when I was in financial hardship myself, and also had feelings of isolation and depression when I reached out for support with Little Village. They were so amazing and lovely that they sort of prompted me to have a catalyst for change in my own community, and in turn I ended up setting up a baby bank myself called Little Peas, which operates once a month. And I try to use this as a base pillar for the community to alleviate feelings of loneliness and isolation, but also to relieve financial pressures from families with small children as well. So I'm really pleased and honoured to be a part of this, and it's fascinating and interesting, and I'm hoping that we can come together with some good ideas for how we can progress going forward. So thank you for having me here.
Oh, brilliant, Ella. Thank you. Whereabouts are you based? Where do you live?
I'm actually in Bromley myself.
Oh, perfect.
Yeah.
Great. Thank you. That's lovely. Yeah, Muna, would you be happy to jump in next?
Lovely. Thank you. Hi, everybody. Lovely to join you. My name is Muna Yassin. I'm the Managing Director of Fair Money Advice. And Fair Money Advice is a specialist pan-London debt advice charity. We've been working in London for over 20 years, providing one-to-one debt advice and financial inclusion services. I think we can say that we serve diverse ethnic communities across London, and we've delivered debt advice through growth years, a financial crash, obviously the austerity years, and now we're going through a pandemic. And I can say that post-pandemic that we're seeing that our communities, the need has never been more acute. So I think it's really timely that we're having this discussion, and I'm really pleased to be on the panel and to hear some solutions amongst the discussion this afternoon. So thank you very much.
Thank you, Muna. That's brilliant. Abby.
Yeah, I work for the London Borough of Tower Hamlets. I've been there quite a while, and I work in public health. So this is about really today for us is about the recognition of loneliness as a public health issue. And the experience of loneliness, I think we've been doing a lot of work over the last 4 to 5 years on community connections and capacity building, and programmes with titles like Communities Driving Change. And we lived through the pandemic for these large community interventions, and the loneliness was striking, but also what comes out the other side, if people are supported, the following resilience is also quite amazing. So there's both the experience of loneliness, which underpins quite a lot of what we do that's named as something else, actually. But actually, it's about loneliness and the ability to connect confidently with other people. So the experience for us as a team and as our, 23,000 contacts over a few years has shown that when you drill down, people lack a huge amount of confidence, and that's the work that you need to do to actually begin to engage with support. And I think that's really the main thing that pulls together some of the work that's happened over the last few years for us, and the resilience that comes from the bounce back that comes from supported communities was quite amazing to see, even though it's ongoing. They're having to adjust even more.
Brilliant. Thanks, Abby. Thank you very much for that intro. That's fantastic. I'm going to share my screen for some slides, but don't worry, because it's going to be literally a 2-minute slide moment. I know that we've all probably seen too many slides already today. But I just wanted to, can everyone see my slide, my screen okay? You can see, oh good, okay, super. Just very, very briefly, I'm from Neighbourly Lab. We're an independent research organisation focused entirely on social connectedness. This report has just been published. There's a link to it below, and we'll put a link in the chat as well, written by us and the Campaign to End Loneliness and What Works Centre for Wellbeing. And the question that this report answers is, we made use of lots of data, and we spoke and understood lots about the first-hand experience of loneliness in London. And I just want to draw out a couple of things from it, and particularly because I think it gives good framing and context to this this topic that we're talking about the kind of intersection of acute poverty and loneliness. The first thing I want to say is we focus particularly on severe loneliness. So that's about 8% of Londoners. It just adds up to a huge number of people, 700,000 people in London, according to a survey of Londoners, say that they are often or always lonely. We call that severe loneliness. And as we all know, that's an extremely kind of painful, very debilitating, incapacitating kind of emotional feeling. We define loneliness for what it's worth. We of course realize that it's subjective, it's different for everybody in every situation, but just as a sort of go-to definition, it's basically, we think of it as a feeling that comes along when you face tough times or pressures, as you said, Ella, just now, without the support you need around you. And so kind of a sort of model where it's partly to do with the connections you have, and partly to do with how you feel about your place in the world and your own kind of psychological resilience. And then this is the last bit I want to share, which is that we did all this data science, and we basically said, okay, there are these 700,000 Londoners who are severely lonely. What else is going on in the lives of these people? And on the right here, you can see these kind of almost shocking findings that we found is that actually there are these extraordinary unequal distributions. The way in which severe loneliness is experienced by Londoners is extremely kind of unequal and inequitable. So 50% of the people who feel severely lonely are acutely poor in London. 61% are single or live alone, which I think is really interesting. Of course, therefore often lacking a protective factor of a partner. Over 40% have a long-term disability, and 60% have recently experienced prejudice. And so and this is the last slide I'll show you, but so these big 5 associative factors emerged for severe loneliness. And I just offer you these because, and obviously you can go into detail about it in the report, because I think this is so useful for organisations who are trying to target or prioritise how to target severe loneliness. So particularly people who are new to London. We found particularly people who are in their first year in London are 1.5 times more likely to be severely lonely. People who rent are much more likely to be severely lonely than people who own homes. And then being acutely poor, food insecurity, this is a huge number. Gives you over 2.5 times the odds of severe loneliness if you're experiencing food insecurity, and again with debt burden. And so similar high levels of correlation with these other factors. So yeah, that's it. I'll stop sharing my screen. but I just wanted to kind of highlight the research and do a bit of a call out for it. And so if you have time, have a look at the report. But let's get back to what we're really here for, which is to hear from our panelists about what's kind of really going on in real life and on the ground around London in terms of people who are experiencing severe loneliness, and particularly how that kind of intersects with poverty. And so, yeah, I don't know, Ella, would you maybe tell us more? It'd be lovely to hear more about kind of your own. I mean, let's start by just hearing from all of us about just what it's actually like. What's the texture? What's really going on for people who are in this situation, and what can we say about what they need? But yeah, Ella, yeah, go on.
Thank you very much. So interesting, actually, those points, really interesting. So I think sort of drawing on personal experiences is where I've kind of centered everything that I've been doing, because it's something that's so close to home for me. And the reason that I went to a baby bank initially was because I had to abruptly stop working due to health risks for my pregnancy. And so I suddenly went from a full-time job to actually hardly any income at all. And while I was in hospital on bed rest, I spent about 6 weeks in a room by myself. And one of the main feelings that I had when I felt isolated and when I felt alone was a lack of sort of connectivity to the outside world, to people, to things that were going on, and no sense of inclusivity and no real sense of purpose for at that particular moment in time. I felt quite scared and quite anxious about what was going on. I didn't feel that I had a team of people around me to support me and uplift me. And I think a lot of the time, especially when we're talking about families, if you have a support network, brilliant. If you're unlucky and you don't, you can often feel much more susceptible to things like depression and mental health issues and things like that. And I think my experience when coming into Little Village was that it was a place not just to receive financial support, but it was emotional relief from the worries of the world. And hubs like Little Village and places which offer this kind of inclusivity is what really helps kind of alleviate those feelings of loneliness, because suddenly you're in the presence of people who may also feel how you feel, and that in itself can really bring that sort of sense of, you know, serotonin and dopamine that you lack elsewhere. And so sort of feeling that sort of warm feeling of being around people that understand, I think personally for me was a game changer, and it really helped me feel that I was part of something. And although I was experiencing difficulty, actually there were people here who understood, and that was amazing. I have found that in setting up the baby bank, that I'm noticing that there's lots of people who have to choose between buying their children new clothes and shoes and being able to attend a parent and toddler group, for example. And a parent and toddler group is where they might feel they can go and see friends or parents thereof. And so they're missing out on, you know, being around their peers and the opportunity to create friendships. And so I do feel that there needs to be more done to set up groups and perhaps community groups which can bring people together free of charge, really, without there being the cost attached to that. We do need more welcoming spaces, I think, as well. And, you know, we are finding as well that, you know, like the report has said, lots of people who are single perhaps as well may feel more likely to feel feelings of extreme loneliness. And that is also true for single parents. We find that lots of single parents who don't have support networks come to see us. Some people who are new to London as well, like you mentioned there. And so there's so many people that need a space, a safe space, to be able to come and share their experiences, because I do believe that through shared experience we can in some way alleviate feelings of loneliness. Absolutely.
Thank you very, very much, Ella. Thanks. Yeah. How did you first come into contact with Little Village out of interest? Did they find you, or did you find them, or how did that all come about?
I think it was through my health visitor, who sort of referred me on to them. I hadn't heard of them beforehand, so having that sort of very early intervention for me was really important. And I think it's important across the board as well to be able to have somebody recognise the vulnerability in the person, and then be able to sort of offer these services, signposting services as well, which is so important for, you know, opening up that pathway to help, really.
Thank you. Thanks, Ella. Muna, it'd be lovely. Share with us what you've seen and experiencing at Fair Money Advice. Great, thank you.
Yeah, actually, listening to Ella, I'm struck by the similarities between loneliness and debt. And the experiences that you shared are very similar to what our clients tell us every day. So debt is very stigmatized, and people feel ashamed of sharing that they're in debt. And then it leads to a sense of isolation and a sense of exceptionalism, that they're the only ones in that position. So what tends to happen is that a lot of people fall into debt because of a life shock. So it could be a divorce, it could be a bereavement, it could be a loss of a job. And through those instances, people tend to then withdraw into themselves. So one of the things that we find is that a lot of our clients don't normalize talking about their financial worries. And what then that happens is they kind of get into a position of anxiety, and their confidence goes. And what a lot of clients tend to do is also withdraw from the world because they can't afford to actually socialize. And one of the key things that we found is where people are in debt, if you don't have that social support, actually managing your finances and having that ability to kind of pull yourself up is that much more difficult. We did a piece of research amongst our client group with University College London a few years back, and we found that for every client that had a support network and a family network, they were 3 times more likely to be able to manage their debt and actually become debt-free much quicker and faster than the clients that didn't. I think one of the things that we also find is that clients are now in a position where actually it's affecting not just themselves, but also their relationships. So where you're finding husbands and wives that aren't even discussing their financial difficulties, that isolation gets even more entrenched in the family. Where you're finding parents and children are having financial difficulties and they're not discussing that, that then means that there's a rift within the family. So that level of loneliness actually increases within people's own family units, which is something I think people don't talk about often enough. I think for me, one of the things that we're starting to see with the cost of living crisis is that actually we're starting to see whole communities that are kind of left adrift. And what we're also seeing is that the age groups are slightly different as well. So we all know about pensioner loneliness and the isolation that as people have empty nests and their children move on, there is a disconnect between their ability to socialize a lot more. But we're also starting to see that highly amongst single people who are either in private rented accommodation, who can't afford to essentially socialize with their friends, and they're literally working and then going home and then working again and being in a room by themselves, and the mental anxiety that that then brings and their ability to be able to. And I think social media doesn't really help because you have this fear of missing out, this FOMO for young people. So there's all this world that's going on out there, and you're actually able to see it and not literally touch it. I think that has added to the sense of anxiety for people. One of the things that we're also looking at is the ability to normalize the discussion around debt and finances. So what we try and do is bring clients together and try and make sure that people recognize that they're not the only person going through these difficulties. And by being able to normalize the fact that actually there are life cycles that where we all go through financial difficulties or shocks, and that it's something very similar to other communities are going through. So we try and do that through our kind of workshops and giving people the opportunity to discuss their finances and the ability to talk about money and their relationship to money. Because I think one of the things that people don't realize is actually we all have different views of money and how we connect with it. And sometimes that's through socialization, sometimes that's through literally an experience that we've had, or it's through how we've learned through our family. So really understanding where our relationship to money comes from. And I think one of the other things that we're also starting to see, which is quite worrying, is the level of need in terms of people going hungry. And I think the more that you are unable to have food and meet your basic needs, the added distress this adds to your mental well-being and your anxiety, which then adds to your confidence levels and your ability to socialize, which then increases your level of loneliness. So I think one of the things that we're trying to do is really make sure that people's basic needs are met, and then you start to think about their emotional needs that go with that. And one of the areas that we try and differ to other organizations is that effectively we recognize that it is an emotional connection, and it's about people and relationships. So really making sure that our advisors are able to kind of connect with their clients and understand their whole lives, not just their financial lives, because effectively finance affects everything in people's lives. So looking at things holistically and bringing in the additional support, may that be mental health, immigration, housing, and making sure that there is that connection around the other areas of their life that finances touches.
Muna, thank you so much. Brilliant. I know there'll be loads of questions from me and from everyone else from what you said and from what you said, Ella, as well. Thank you so much. Abby, it'd be brilliant if you'd tell us where you're at and what you're focused on in your borough. It'd be brilliant. Thank you.
5 years ago, we recognised that there was loneliness was harmful to health, and the impact of social isolation was affecting people of all ages, both mentally and physically. And since then, we've taken up loneliness as a public health priority, actually. So we're talking very much at the population level here, and the sort of experiences of working at that level. So we did some research with community researchers during about 4 years ago, and looked at the issues that people expressed were affecting them most. It's everything you've mentioned, and the impact was both physical, mental. It had an impact on family experiences. The issues were caused by housing poverty, and had also severe impacts on communities as well, around cohesion and levels of safety, and social networks and places and activities were the key things that people needed at that time. So in 2019, the mayor of Tower Hamlets established a loneliness task force, I suppose with the aim of empowering communities, and we started to offer small grants to local and community organisations. So the fact that the loneliness task force was set up by the mayor meant that it formed one of the mayoral priorities. It had a governance structure, and also linked into the local strategic partnership, which is called Tower Hamlets Together, under their Living Well working streams. So that begins to bring in some of those questions around how does this get embedded across all at a system level. So the first round had 28 projects working on a variety. The first round of grants, community grants, had a variety of projects, total of 28, with looking at the provision of food and connection to older people, a men's theatre group, and quite a diverse set of other projects, which I won't go into here. And then again, like the other speakers have mentioned, the pandemic hit, and we've found more creative ways of linking people together. And for example, our community programs that were ongoing at that time sort of transferred to and did the phone rounds. This is really simple. You know, if you've got volunteers, you phoned them up during the pandemic, you sorted some of their problems out, took out, learnt from them how they were coping to pass on to other people. And then gradually, as the lockdowns got released, people bounced back, as I mentioned before, in the people that we were in contact with, or the commissioned projects were in contact with. So the grant scheme then has continued, and extra grant schemes were issued by the Mayor's Recovery Fund as well. More recently, we've moved on to, you know, we've got a wide catchment of small local community organisations and wider ones that form part of the task force, but actually receive the grants. And we've recently brought those people together in a connections network, sort of mirroring the Connections Coalition more nationally. We've had a launch event, and we're going into our first meeting on the 25th of May, looking at how really people and groups and local organisations need to be empowered around tackling the underlying sort of determinants of loneliness and the symptoms of loneliness as well. And alongside that, we have mental health projects looking at our mental health transformation, which is looking at a trauma-informed approach, which I think the speakers actually have been talking about. You know, in terms of the mental health approaches that can be used. So moving on, just to look at the connection, you know, what we're really aiming to do with the task force, and it goes hand in hand with our approach to tackling localised inequalities. That's what we've always been sort of keen on, is actually looking at within borough inequalities and within locality inequalities as well. And that really sort of tells you the depth of our sort of work, really. Now, it's not been easy, but I just wanted to say that this is also, we've had a change of administration, as you may well know, and that loneliness seems to be on the manifesto. And more recently, we've had other research programmes, a befriending needs assessment and recommendations that's recently come out with a commissioned piece of work. And we have a larger scale loneliness and disabilities project that's ongoing. With the Connection Network, we're aiming to get a person in post, websites and other facilities that can support small organisations to connect their learning and experiences over loneliness and social connection.
Brilliant. Abby, thank you so much. Yeah, it
Pleasure.
sounds amazing, everything you're doing. And yeah, I guess I'd love to, I mean, it was interesting, you know, when you were talking about, you just described that kind of compound effect of how almost that sort of cycle of with different stresses that can interrelate with each other in someone's life, and how one thing leads to another, and how you know, the lack of social support makes debt harder to deal with, and then how debt makes sociality harder to do. How do you know where to sort of start in terms of helping people? You know, because you talked about the social, the emotional needs, and the more practical needs, but how do you and your advisors judge kind of where, you know, how to begin or how to help?
That's a really good question. And actually, I think there isn't a fast and hard rule. So it depends on the client. So some clients are very open. And so we start each client with an assessment, and then that assessment will look at their whole circumstances. So we'll use finance as a focus and a hook to kind of understand their family structure, their kind of housing, employment, all of their health needs. But then we'll also start to ask them specific questions around what they'd like to achieve, what keeps them awake at night, what are the things that they'd like to be able to change in the short, medium and long term. And then it's a rapport between the advisor and the client. So some clients will tell you everything in that first interview. Some clients, as you start to work through their emergency issues and they start to trust you, they will then start to share a bit more about their kind of emotional feelings and where they are. So I think it's about making sure that there is the ability to have those conversations. But what we try and recognize is that actually finances, and especially when you're in a crisis, can be very, very overwhelming. So what we try and do is kind of break things into bite-sized chunks. So people are able to kind of understand, well, okay, you have a bailiff at the door. This is what we're going to concentrate on first. Then we'll focus on actually what are the other wider areas of support that you need. And then so they kind of see what's coming down the line and they can start to prepare for that. I think the area around emotional support usually comes through understanding people, whether or not they're isolated, whether or not they've got people around them to help support them. And then we'll start to work through if there are any kind of mental health needs, any kind of isolation needs. So we work a lot with befriending networks, so where we recognize people are isolated or don't have somebody to talk things through with. We will also ensure that we're kind of working with those organizations to connect people. And I think one thing I'd like to be able to stress is actually sometimes the way that we work as organizations can actually add to people's stress and add to their kind of level of isolation. So constantly asking people to repeat their stories and referring somebody to another organization can sometimes actually reinforce where they're at and just focus on the problem. So what we try and do is make sure that we take all of that burden off them. So if we're referring to another organization, we will ask for their permission to be able to share the kind of key pertinent information so they don't have to do that whole repetition. And really making sure that we're just not adding to that person's burden. And I think bandwidth is a massive issue. So where you're having to deal with so many different elements that you're trying to deal with, and especially around finances, people sometimes don't have the bandwidth to be able to cope themselves. So making space and making that bandwidth available for them to start thinking about other areas in their life. So be that their emotional health, their mental health, or their physical health.
Yeah, I see. Yeah, brilliant. Thank you. Thank you for explaining that. And Ella, I don't know, in your experience, how do you and your team kind of judge when it's about just providing basic needs to people, as it were, you know, helping people with nappies, as it were, or when it's more about emotional needs? How does that work?
I think it's, yeah, absolutely. So I think it's a holistic approach, in generally speaking anyway, because 99% of the people who are coming through the doors have already had to overcome the stigma that they feel in themselves for approaching a baby bank or a food bank. And that's a huge task in itself. I mean, I've done it myself. And it took a long time for me to tell people, friends, family, that I had done that. And I think that there's a very long way to go in terms of what society, you know, that society's thoughts on you know, approaching food banks, baby banks, things like that. And so we found, similarly to what Muna has said, that everything's interconnected. So you'll often find that when you are sort of receiving help or giving help, the emotional side of the difficulties that they're facing, along with housing is a big issue, you know, mental health, they're all in the same sort of bracket. Also, another thing that we found is that English is a second language for lots of people. That initial language barrier can be really difficult. So trying to make sure that we're aware of the fact that lots of people who are coming to see us could, as I say, be new to London, but also may not be able to communicate to you effectively what their needs are. And so being sensitive to that is really important as well. Also, you know, just trying to find out as much as humanly possible about the people that we're involving in what we're doing, because everyone's experience is different, but collectively you'll see that so many stories are similar. And financial hardship is something which, you know, is a really difficult thing to face. And the loneliness that comes along with not being able to go to places, not being able to get on the bus, not being able to afford to shop sometimes or buy essential items is a really heavy thing to have to deal with. And, you know, some of the people that do come to baby banks, that's the only time they've been out in a week or a month. And so really highlighting that and being aware of kind of, okay, this person may not have actually left the house for a really long time. You know, we do have so much to do to ensure that we are helping them when they are at the first point of contact, to help in whatever way we can at that moment. Not to overwhelm, but to kind of offer as much as we can. and they can take that away with them if they'd like to, but at least to kind of really utilise that initial meeting as much as possible, I think is really valuable. I know it was for me. Yeah. Thanks,
Ella. Yeah. And then I've got one last quick question for you, Abby, and then after that we'll open up to questions from everybody. So have your questions ready if you've got some. But Abby, I was curious to know, as well as the sort of civil society organisations which you are in Tower Hamlets kind of nurturing and coordinating and enabling, I'd be interested to know, in a point of service delivery, like for example in your housing teams, what's different now as what was different a few years ago in terms of how loneliness is understood? Are you dealing in your interactions with residents? Have you changed the way you approach people or think about kind of, as it were, their emotional 3 dimensions?
Oh yes, certainly. And I can't speak for housing because it's not completely integrated into the integrated commissioning process.
Tell us about another service.
No, but social services, certainly they were writing at the beginning of adult social care, particularly. We're writing on the beginning of the emergence of our concern about loneliness and measures. So there was certainly training schemes developed for all through COVID. These schemes were developed for frontline workers. In terms of housing, the mayor's recovery funds have been available for different departments, certainly for homelessness, or what we call the homeless persons unit. They have been able to get navigators working to reach out to people in temporary accommodation, whether in borough or outside borough, to actually start to link people in. I mean, it was a tall order, and they wanted us to take it on, but we felt it was actually, doing out of borough work is a very specialist approach in terms of working with people who are in temporary accommodation, for example. Children's services are very active. They are doing poverty prevention plans for their children at the moment. They've just piloted that, so we need to see where that's going. But in terms of actually frontline workers being able to ask about social connection and loneliness as a key part of an assessment process, whether that's triage through our Tower Hamlets Connect portal, where people can actually go on and find a service, talk to an advisor, and then be referred on. That includes the community commission sector as well, and the non-commissioned groups, but also our residents hub, which is just opening in the town hall, where people can actually meet face to face. And my team's taking on the wellbeing function for that, but there is a tackling poverty team there. There's a housing team, there's a social care team, who people can meet in person. I'm not going to say they're going to be able to meet exactly when they want. I think, as we've heard, statutory and community services are very, very pushed at the moment, but actually those are all linked so that people can make actually direct referrals. For example, the biggest thing in terms of where my team's sort of work lies is in depth in communities. You've got the primary care trusts, the primary care networks, and we are trying to embed primary care networks as very local organisations, like a primary school. It is very local. You can actually embed something that we call co-production in that, and how the community makes a relationship, not the individuals, but the groups and the self-organisation in communities can actually make an active relationship with the GP surgery to actually do the projects that they want, that they feel. For example, we in our community driving change, we hit so many outputs in terms of just parents organising around schools and communities for activity packs for older people. They went out in thousands every week. So that's an activity, but actually you've also measured it, you've got the number, and you know where to go next, because you can go back to them. So where you can have repeated, what we've learned, where you can have repeated conversations, whether that's in the entrance hall of a block, and it's actually street conversations. It's that real asset-based approach that's saying, So that's where we're at on that. But it's large scale for us now.
Brilliant. Yeah, we're big believers as well in this idea of these kind of repeated micro interactions, these interactions which seem small on their own but add up in aggregate.
Very significant. It's a
Very
smile.
significant.
It's a smile from somebody.
Yeah, exactly. It
that
all
can
adds up.
make the day.
Totally.
Well, it does mine still now.
It's me too. Yeah, totally.